Okay, so I'm here with author of The Oxygen Advantage and an absolute mind of knowledge when it comes to breathing techniques. And he's one of our own as well, which makes it all more special. So I'm here with Patrick Mckowen. So I'd like to welcome you on the podcast, Patrick.
Thanks very much, Adrian.
No problem at all. I guess the first question I wanted to open with was, why do we all breathe so differently? Like, why is it that the one commonality among all of us as humans is breath? And why is there such a diverse range of breathing patterns, techniques, and observations?
I suppose there's a way to breathe, and then modern life gets in the way. And genetically as well, individuals can be more predisposed to picking up poorer breathing patterns. If we were to look to literature, a Cochrane review will say that there's about 9.5% of the population have breathing pattern disorders. But in other papers, it shows that up to 80% of individuals predisposed to anxiety and panic disorder, and about 30% of individuals who are predisposed to asthma or childhood asthma. So I think there's a number of different reasons. We don't live the same way as we did throughout our evolution. We're very much sedentary. We're under more chronic stress. Our food is different. Houses are different. And also there's a belief out there that it's good to breathe hard or take more air into the body. And in actual fact, that's completely the wrong thing to be doing if the goal is to increase oxygen uptake to the tissues and also from the lungs to the blood, but also to the tissues. So there's a lot of ideas out there about breathing, which in turn, can influence how people breathe. And, even the simple thing of breathing through the nose, it doesn't really get all that much attention, but yet when you break it down, what nasal breathing does for sleep, for the emotions, and also for physical exercise, it's really important.
Absolutely. And, it just blows my mind how breathing isn't part of the education system, especially, for kids and for children. Obviously you would see the merit in it. Okay. Do you think that would be a difficult thing to try to roll out?
I would love to roll it out. We launched our children's breathing program free. It's completely free online. I put every exercise that I've been teaching for 20 years for kids, I put it out free on the internet. We would love to see children. We would love to see a greater awareness of children breathing through the nose. The studies are showing that between 25 and 50% of studied kids are persistent mouth breathers, and this is affecting their sleep. And children with sleep disorder breathing, in a study by Karen Bonnock that was published involving 11,000 children, over, I think, about 8 years, but it showed that children with sleep disorder breathing, which includes snoring, they had a 40% increased risk of special education needs.
Wow.
Children who are tired, they have 10 times the risk of learning difficulties. And I was one of those kids. I was a mouth breather because of having asthma. I had rhinitis, my nose was stuffy. It affected the development of my face, my airways, it affected my sleep, and it absolutely affected my concentration. And for me to get grades, I had to spend a lot more time studying. Now, I got my grades, but it took a lot of work. And kids, unfortunately, are labeled as being intelligent based on their academic success, but nobody is looking at their sleep quality. And when they're looking at sleep quality, I'm not talking about, the length of time that they're breathing, that they're sleeping for, but I'm talking about the depth of sleep that they can achieve. And nasal breathing is a key part of this. And just to mention it before I forget, but Dr. Christian Guilleminault, he's deemed as one of the founding fathers of sleep medicine. He was a Stanford-based medical doctor who passed away about 6 months ago. And I've spoken alongside him at different conferences throughout the world. And I've seen him get up and he's saying to his doctor colleagues, we're talking about everything for improving sleep, but we're missing the real point here. Because the only valid, and this is his quote, the only valid and complete correction of pediatric sleep disorder breathing is restoration of continuous nasal breathing both during wakefulness and sleep. He said, let's get children breathing through their nose, not just during sleep, but during the day as well.
Yeah. And it's amazing because I've been at so many talks and so many conferences where, the importance of sleep, and we speak about sleep hygiene, and you know, staying off mobile phones before you go to bed, and, you know, even down to meditating before you go to sleep and the last thoughts you have in your mind or the subconscious mind. But not once does anyone ever make the point about whether you breathe through your nose or through your mouth when you sleep.
Yeah.
So therefore, therefore, we're really putting the cart before the horse, aren't we? Because, you know, we're really looking at those 1% when the 99% is there in front of us, isn't it?
Yeah. I think when the founding father of sleep medicine is talking about it, and when he's published papers on it, and normally it takes about 20 years for something to change in medicine. So he's been talking about the importance of nasal breathing during sleep since 2010. So at that rate, we have another 10 years to go before it becomes more mainstream.
Yeah, it's and even down to like when we were talking about facial structures and like craniofacial development and so forth, you know, Western A. Price, who is a dentist, you know, are you aware of the Western A. Price
I have his
Foundation?
book. His book is behind me here somewhere.
Is it? Yeah. So it's physical nutrition and physical degeneration, I think. Yeah. But, you know, like it was actually, that was the first time I was ever reading that book. I was ever introduced to the fact that, okay, nutrition plays such a big part in, you know, your cranial development and your facial development and so forth. And then when you look at, you know, the mouth breather is nearly, you know, he's nearly, I suppose, stereotyped as being goofy and being, you know, being stupid.
Of course.
And, you know, like think of Cletus and The Simpsons, for example, you know, the hillbilly family, you know.
Yeah. But Adrian, it's normal, because if you go into Google, no matter what country you were in, and if you put in mouth breather, it will come back as a stupid person. And I think typically and traditionally, because the individuals who were mouth breathers were deemed as, well, maybe they had a lesser intellectual capacity or a mental capability. Yeah. And as a result, they were mouth breathing. It wasn't the norm for human beings to mouth breathe, and it's still not the norm. It's very common. Nobody is talking about it. And Weston Price did touch on it in his book, Nutrition and Physical Degeneration. In around page 55 of that book, he talked about individuals living off the Hebrides Islands in Scotland. And when they changed from a traditional diet of fish and oatmeal to a processed diet, first generation children became mouth breathers. These children had crooked teeth, they had narrow arches, they didn't have enough room in their mouth for their tongue. And if there's not enough room in the mouth for the tongue, well, the tongue is going to be falling back into the airway. So the shape of the airway is getting more narrower. This is affecting our ability to do physical exercise. We need to have a decent airway, and it's also affecting our sleep. So conditions such as snoring and obstructive sleep apnea, they will increase when the airway is getting smaller. And it's already very prevalent in the Western world. You know, one statistics from Switzerland showed it was 9% of female and 26% of males aged between 20 and 49 years of age. But from 50 to 70 years of age, it's 27% of females and 43% of men. Now, men can be at a much higher risk, especially guys who have larger neck circumferences. So when you hear of a young guy, 40 years of age, and he's after passing away, dying in his sleep, I would always suspect that there's a problem there with his sleep. And the sleep issue there is obstructive sleep apnea, because you can be stressing your heart during the day during physical exercise, but it's really important that you get recovery at sleep. You don't want to be stressing your heart during sleep as well.
Absolutely. And so if we go back to the tongue, okay, essentially, so the tongue has two places to go. If you're breathing through your nose, your tongue will sit to the roof of your mouth. But if you're breathing through your mouth, then that your tongue is essentially going to obstruct and block your airways. Would I be correct in saying that,
Yeah. Here's anatomical model of the nose. And basically the airway, the size of an airway is about the size of a hose pipe. And mouth breathers will typically have their tongue sitting low or midway. It's either on the floor or it's midway in the mouth. And as a result, then the tongue can be more likely to fall back into the throat. And it's when the tongue is falling back into the throat, but it's not the only place at which the airway could collapse during sleep. It could be a partial collapse or it could be a complete collapse. You've also got the soft palate falling back into the throat. The tongue is falling back. The epiglottis can fall back and the throat as well can collapse. But Sleep medicine has changed a lot in the last 5 years. Traditionally, it was recognized it was mainly an anatomical issue. But now researchers are recognizing that there's 4 phenotypes. One of those is anatomical, but 3 are non-anatomical. And the 3 are actually related to your breathing. And nasal breathing is the key. And the issue is that if we are with mouth breathing because of rhinitis, like it's been known that individuals with a stuffy nose, they're twice as likely to have sleep problems. So if I was to look at a football team or any team or a hurling team, I'd be looking at these guys. Do they have their mouth open during rest? Do they have their mouth open during light physical exercise? Do they have a stuffy nose, which you can decongest your nose by holding the breath? You can measure your breathing performance by measuring the length of your breath hold time. One of those breath hold time measurements has also been brought into sleep to assess for what's called loop gain or high loop gain. Mm-hmm. And we can make changes to breathing patterns to improve breathing efficiency. This is coming back to basics. It's all about getting oxygen delivery to the tissues. How can you breathe to optimize oxygen delivery to the tissues? There's a way to do it, and it's not by breathing hard.
Yeah. So we can increase blood oxygen saturation by slowing down and breathing deeper.
Yes.
And I think you use the acronym LSD, I think, for that, isn't it?
I do.
Light, slow, deep, yeah.
Yeah, that's for the 1990s generation, so they're going to remember it, you know.
Yeah, I suppose that would definitely give some kind of an association to something anyway. And it just, if we bring it back to the nose for a second, so when we think like why the nose, nitric oxide plays a big part in this, doesn't it?
It does. It's one of the, nitric oxide was first discovered in the exhale breath of the human in 1991. And when we breathe through the nose, nitric oxide, it's released into the paranasal sinuses, but it's also released in the nasal cavity. So when you breathe through your nose, you're picking up this gas and you're carrying this gas into the lower airways. And there's a greater quantity of nitric oxide produced in the upper airways than the lower airways. In the lower airways, in the lungs, nitric oxide is a bronchodilator. It helps open up the airways, but it also redistributes the blood throughout the lungs. So it plays a role in improving gas exchange. So in 1988, researchers Swift, they noted that patients who were after having jaw surgery, when their jaws were wired shut and they were forced to continuously breathe through their nose, the pressure of oxygen in the blood increased by 10%. And that's a huge change. Now, you might necessarily see a massive change in the SpO2, but in terms of, we have to consider that oxygen is carried 2 ways in the blood. And 98% of it is bound by hemoglobin, which is a protein within the red blood cells. And 1.5 to 2% is carried dissolved in the plasma. So nasal breathing does increase the oxygen uptake in the blood, but nose breathing as well during rest, you typically will breathe slower. You're activating the diaphragm, and that in turn is going to improve oxygen uptake. But diaphragmatic breathing with nasal breathing is also important for functional movement, because your diaphragm is not just the main breathing muscle, but it also plays a role in the generation of intra-abdominal pressure. So typically if a weightlifter is lifting a weight, he'll breathe in and he will hold his breath. And as the diaphragm is moving downwards, it's like the abdomen is almost that it becomes a pneumatic balloon to provide stabilization for the spine. So functional breathing will influence functional movement. And when you have functional movement, you're less likely to have risk of injury. So Kiesel in 2018, he assessed breathing patterns and from a number of different dimensions, but he concluded that the breath hold time, which is the bolt that we use, and it's described exactly as the bolt. You have the person sit down, take a normal breath in and out through their nose, hold their nose, pinch their nose with their fingers to hold their breath, and time it in seconds until you feel the first involuntary movement of the breathing muscles. And then take a normal breath in through your nose. In other words, it's not the length of time that you can hold your breath for to a maximum. It's only the length of time until the brain reacts to the fact that you've stopped breathing. But Kiesel's conclusion was that if you have a bolt score above 25 seconds, there's an 89% chance that you don't have dysfunctional breathing. Now, I've sat with players, I've sat with Olympic athletes, I've sat with some really like elite players, MMA fighters, quite a few of them are using this, and their bolt scores can be 15 seconds. And a low Bolt score is a measurement of the degree of dyspnea or breathlessness. And that's typically, like, if there is an issue with the lungs, it manifests in a lower breath hold time. So if you were to see a player who's gassing out or she's gassing out too soon, they've got premature breathlessness, they've got disproportionate breathlessness, they've got muscle fatigue, I would be interested in saying this may not be down to a lack of condition, but this could be a breathing pattern disorder. And bearing in mind that certain pockets of the population are more prone to breathing pattern disorders than others. And those individuals with a low Bolt score and a breathing pattern disorder, their progress will plateau. So I think there's something here that certainly some individuals, their breathing will be holding them back, but they won't be aware of it.
Okay, that's very, very interesting. And just in terms of the Bolt score, so that's like the body oxygen level test, isn't that it?
Yes. Yeah.
That is essentially the same as the control pause test, isn't it?
Exactly. Yeah, it's taken from Buteco. It's just the control pause. I just changed the name because the control pause, people are trying to get their head around it. But yeah, it's the same. It's the body oxygen level test. It's a breath hold time.
Excellent. And interestingly enough, my Bolt score is better when I'm on the walking test than I am sitting down.
Yes. So doing the walking test is a different test, but there is a correlation. I put a correlation together a few years ago. So we have two scores. One we use is the Bolt score as a measurement of the onset and endurance of breathlessness. And that's taken from work by Nishino in 2009. And then the maximum breathlessness test, we use that to determine what's the maximum capacity of the individual to tolerate breathlessness. So the maximum breathlessness test is you take a normal breath in and out through your nose, pinch your nose, hold your nose, start walking, and count how many paces can you hold your breath for until a maximum. And then let go, but make sure you have breathing recovery and breathe through your nose. And the goal is 80 paces, but less than 60 is not ideal.
Okay. Whereas the Bolt score, your first
yes,
like intuition to breathe,
yeah,
you're gone too far at that point.
Yeah, the Bolt score is more objective.
Okay.
See, the maximum breathlessness test is influenced by willpower and determination. And just, I would say, if anybody has high blood pressure, don't do it, or any cardiovascular issues, or if females are pregnant, never do strong breath holds. But for healthy individuals, it's a very normal thing for a human being to do breath holding. Our ancestors did it. You go to a swimming pool, you'll see kids throw a diving stick into the water. So it's a normal thing for us to do. But it will also open up the nose, and it increases blood flow to the brain when you hold your breath. It's like that thing, people often say, if you're stressed, take a deep breath, and you see the person take this big breath, or they're filling their lungs full of air. All that's going to do is wash off carbon dioxide. And carbon dioxide is not just a waste gas. If you're breathing too much air, you get rid of too much carbon dioxide from the blood through the lungs, and this will cause blood vessels to the brain to constrict. So in actual fact, the more air you breathe, the less oxygen that gets delivered to the brain. If you want to increase blood flow to the brain, hold your breath.
Okay, that's really interesting. And in terms of improving your Bolt score, and would breathing through your nose,
it would help.
Yes. Would that alone help, or would you have to do
No.
the specific exercises as well?
So you'd have to breathe through your nose both during wakefulness and also during physical exercise, during running. And I think there's tremendous gains to be got if individuals do quite a bit of their training with their mouth closed. Yeah, it's tougher. It's adding an extra load onto the breathing muscles. It's also increasing carbon dioxide in the blood. But in time, in a few weeks, if you switch from mouth to nose breathing during physical exercise, in a few weeks, it forces your body to make adaptations. And I'll give you an example. This is not getting, the science with this is only starting to catch up. And there's very few papers investigating nasal breathing during running. But one was by a triathlete in the United States. He's also an academic called George Dallam, D-A-L-L-A-M. He got 10 recreational athletes. He had them train with their mouth closed for 6 months. He then assessed their capacity 6 months post, just at the end of the trial, and they were able to achieve 100% of their work rate intensity with nasal breathing as with mouth breathing, but they had 22% less ventilation with nasal breathing. Now, 22% less ventilation, that's an economy. There's a saving there. And we have seen athletes over and over, like one of our guys, George Karakanian, is an MMA fighter. And he's kind of the face behind it. He was fighting in Dublin there a couple of weeks ago against Paul Redmond. But these athletes at top level will tell us their breathing, their recovery is better. It's less trauma to the airways. Anybody with exercise-induced bronchoconstriction. You're also, when you're mouth breathing, you're more likely to be in a fight or flight response. So coming back to it, I would say nose breathing, both during rest, but also spend quite a few sessions, especially during the warm-up. Like during a warm-up, I would say to anybody, do your warm-up entirely with nasal breathing. It's a low enough intensity, or it should be. But in the warm-up, also do 5 strong breath holds. So I would start off athletes, we would have them warming up. I'd have them up just say walking slowly at the start, have their hands on their lower 2 ribs, and have them with lateral expansion and contraction of the lower ribs. So as they breathe in, their ribs are gently moving out. And as they breathe out, their ribs are gently moving in. And I would have them focus on their breath. And this would be to help calm them if there's any pre-match anxiety, just to help center them, but also in terms of, activating diaphragmatic breathing. Now with that, then I would have them increase the pace, maintaining lateral expansion and contraction of the lower ribs. And then I would have them do 5 strong breath holds, because I would use the relaxation and the lateral expansion to activate a parasympathetic response to calm the individual. But you don't want them too relaxed going out. And then I would do 5 strong breath holds. And 5 strong breath holds, it increases blood flow to the brain. It's a bronchodilator. It helps open up the airways. It opens up your nose. If you do the maximum breathlessness test, and you'll see it free anyway. It's up on the oxygenadvantage.com, the homepage, if anybody wants to try it. But if you do that a few times, you'll feel your nose opening. You'll feel more alert. But also, with the oxyhemoglobin dissociation curve, this is a curve that explains the release of oxygen from the red blood cells to the tissues. An exercising muscle is hot and generates more carbon dioxide. So during the warm-up, the whole idea is to increase the temperature of the muscle, to increase more oxygen delivery to that muscle, but also increase carbon dioxide. And you can do that by holding your breath. So if you gently increase the temperature of the muscle and you increase carbon dioxide, more oxygen gets released to that muscle. And this is a good way to start pre-physical exercise. And that's not even including spleen contraction. Your spleen contains about 8% of your red blood cells. And if you do 5 maximum breath holds, and I'm not talking about going blue, but I am talking about challenging breath holds after an exhalation. You take a normal breath in and out through your nose, you hold your breath, and you hold your breath for a fairly high intensity. And we would have individuals start off walking. So basically, I would say, okay, in, out through your nose, hold your breath. Start walking, holding your breath. Now walk faster. Now jog faster. Keep going, keep pushing, keep going, keep relaxing into the breath hold. When it gets pretty tough, let go, breathe in through your nose, minimal breathing, get your breathing back to normal, and then do it again. And it's a great preparation just for a warm-up. So I'll just come back to, I'll answer this one briefly. Sleep time, we need to get them out closed. We use paper tape. I know that would sound bizarre. But also slow breathing exercises to improve functional breathing. And we're talking about breathing from the point of view of, we do light breathing to improve the biochemistry. We do slow breathing, cadence breathing, because it's very good for in terms of balance between parasympathetic and sympathetic or relaxation and stress response and balance there. We want to improve resilience. We do biomechanical breathing exercise to improve functional movement, but we also do strong breath holding to stress the body to cause adaptations.
Excellent, excellent. There's a couple of things I wanted to jump back on there anyway. I think if we could just jump back to the warm-up for a second, right?
Yeah.
So obviously there's some really, really good physiological and psychological benefits of that, because, you know what I mean, we're just going to calm lads down, because an awful lot of this is, you know what I mean, people who suffer from anxiety, there is that that correlation of shallow breathing and that stress response and
Yeah.
the hormonal response you're going to get from that as well. So just so I can understand that breath hold again, so you're saying like 5 breath holds as part of the warm-up. If we're looking for that 80 steps as being optimal, okay, in terms of those moving breath holds,
Yeah.
maybe for a lot
Yeah.
of guys, like I have had maybe about 15 to 20% of the players who I have been playing with this, and we have been definitely implementing some of this. And where we kind of get unstuck is at a certain threshold, we're okay. But then as the intensity of the movement increases, that's where it starts to break down slightly and people revert back to type 2, more mouth breathing again. So is that just a case of sticking with it, or would you have any strategy in particular for that?
Yeah, like air hunger diminishes during physical exercise once you persist with it. Now, I know guys aren't going to switch to 100% nasal breathing during physical exercise, but certainly try and do a lot of the lower and mid-intensity stuff with the mouth closed. There's no right reason for you to have the mouth open. Nasal breathing during practice is going to add an extra load onto it, and the body will adapt to that. Your tolerance to carbon dioxide improves, and your degree of breathlessness will decrease.
Mm-hmm.
Now, if I was to give you an example, there's a guy called Woorons, Woorons, and he's a researcher from Paris 13 University in France. He got elite rugby union players, 21 of them. He divided them up into 2 groups. This was during peak season. They're professional rugby union players. He divided them up into 2 groups. I think it was 10 in one and 11 in the other. And he got them doing repeated sprinting 40 meters on a breath hold. Same technique that we use. Exhale, hold. You take a normal breath in and out. Pinch your nose, hold. Sprint for 40 meters on the breath hold. 30-second recovery before you sprint again. 30-second recovery before you sprint again on a breath hold. 8 reps to 1 set. He had the controlled group doing high-intensity interval training. He had them do 2 sets of 8 a week, which is not very much at all, by the way. You do it in a few minutes, and over 4 weeks. He measured their repeated sprintability, which is a performance indicator in team sports. It's the ability to do an all-out effort followed by a very brief recovery. Pre-trial, they were doing 9 reps before exhaustion. Post-trial, the experimental group who were doing breath holding on the exhalation, they achieved 14.8 reps before exhaustion. The control group who were doing high-intensity interval training, they didn't change. They still had 9 reps before, maybe it was 10. It was very insignificant anyway. So here's my point. I think just by making changes to a player's normal routine, introducing nose breathing, but also introducing breath holding, and say, for instance, during a practice session, the guys there, they're warming up, everything is nose breathing. During the warm-up, do 5 strong breath holds, but keep a minute's rest between each. So it doesn't matter what sort of exercise they're doing. They're doing high knees, they're doing whatever they're doing. Have them do it all with the mouth closed. And even if they were jogging on the spot, normal breath in and out through your nose, hold your nose, and jog on the spot until you reach a maximum intensity air hunger. Then let go, breathe through your nose and back down to walking to recover. Do that 5 times. During the practice session, mouth breathing when the intensity gets too much, nose breathing when the intensity is fine, and at the last 10 minutes of practice session, I would say everybody should switch to nose breathing. Tape them up.
Okay.
The reason being is, put the extra load on when they're tired. There's a psychological and a physiological reason, and I'll explain what I was doing with 400-meter sprinters from Notre Dame University a couple of years ago. But, when our athletes most fatigued, it's going to be the last 10% of a game. And this is when we put the extra load on during training. So I would say switch to nasal breathing at the very, very end. Yeah, it's tough. And it will slow them down. But this is where we're adding an extra load, which slows them down initially. But after a few weeks, then the air hunger is changing. And then at the end of it, make sure then recovery, that we're activating a very slow, gentle breathing to get breathing under control, but also reducing the respiratory rate. Don't ever it's not efficient to breathe fast and shallow. It's the worst way to breathe. We're wasting more air to dead space. It's reducing oxygen uptake in the blood. It's a waste of energy. You know, there's a cost associated with breathing. And if we have poor breathing patterns, up to 30% of oxygen consumption can be devoted to your breathing muscles during a hyperventilation provocation test. So your breathing muscles require a lot of oxygen. And if we're not breathing efficiently, we're wasting energy. And I'll make another point that a certain amount of athletes can be prone to diaphragmatic fatigue or muscle fatigue. If the breathing muscles fatigue, blood is stolen from the diaphragm to feed the diaphragm. So if you see an athlete and they're pushing themselves, and the next thing is their legs give out and their legs are going jelly, that may not be a buildup of hydrogen ion. That could be diaphragmatic fatigue. And even we can delay the buildup of hydrogen ion, because if you're doing strong breath holding during normal training, the whole purpose is to lower blood oxygen saturation, increase carbon dioxide in the blood. This increases hydrogen ion. This is disturbing the blood acid base balance, and this is forcing the body to make adaptations to increase the buffering capacity. And here's the thing, Adrian, nobody in Ireland is doing it. They're not doing it. 95% of my work is outside the country. Like, the Oxygen Advantage has gone into 14 different languages. And at the weekend, my training was in Sydney. And the week before that, it was in Los Angeles. And I'm repeatedly booked out. But the problem is, in Ireland, it's about 3% of my work. And I think any athlete who takes it on board, and I would say, don't just believe me, try it and see.
Yeah, no, we have experimented with it, as I said. And again, like, what we actually done was I would make some of the lads have a mouthful of water.
Yeah.
You know, so
yes.
It was a way for me to objectively measure whether, you know, because you can imagine you're in a position where you might have, you know, 15, 20 lads at one time. And, you know, you're training, you know, I suppose this is the realistic nature of GA. You might be under floodlights on a Tuesday night. The lighting mightn't be great. You can't really tell if someone is sneakily breathing through their mouth.
Yeah.
And just that mouthful of water was a, you know what I mean? It's a cue for them, and it's a constraint for them.
Yeah, totally. Yeah. No, I've heard many different tribal groups using it, and Spartan runners using it as well. It's a traditional thing, and I think it was an initiation as well that the individual had to run 10 kilometers across a desert or an arid climate and reach their destination to be able to spit out the mouthful of water. And it makes sense, because if you breathe hard through an open mouth, you lose moisture. And if you're running or hunting in a very hot environment and you're mouth breathing, you're going to lose more moisture and you're more likely to risk dehydration.
Yeah.
So I think that was a great idea.
Yeah.
Good stuff.
It's amazing, like that, you know, we wait for all these double-blind studies and we wait for everything to be scientifically validated. But, you know, if these things have been used through millennia and through cultures, you know, it was passed on to the next generation for a reason. Yeah,
totally. Listen, like, anybody with nasal obstruction, with asthma, like, if you think of, you're going to have a certain few lads there with bronchoconstriction, it's going to be 10% if it's reflective of the population. These individuals will sleep with an open mouth. They'll wake up tired. I was a mouth breather. My nose was stuffy. I was never once told to breathe through my nose. I think it's dreadful. I absolutely think it's so terrible, that simple information that can be imparted to help people. Yeah, I know there's a bit of a transition when you make the switch to nose breathing, but I would say there is no way you're waking up feeling fully refreshed if you're waking up with a dry mouth in the morning. And if you're not having a good night's sleep, you're not going to perform, because we're talking about a connection here, a bi-directional relationship between the emotions, between breathing, and between sleep. Mouth breathing, hard breathing during sleep increases the risk of sleep disorder breathing. You're more likely to feel unrefreshed when you wake up. That's going to affect focus and concentration. When focus and concentration, or if the mind is more agitated, that's going to affect breathing. When we breathe hard and fast, it affects the emotions. And when we have agitation of the mind, it affects our sleep. So each one of these three key areas in life, in health, in sports performance, are interrelated. So I think it's really important to emphasize breathing is not just something for a load of hippies or tree huggers. Not that there's anything wrong with them, but we've got SWAT guys using it, special weapons and tactics in the United States. One of our instructors is Joey Williams. He trains his members with the same techniques. And the reason being is because these guys are going into a stressful situation, and it's all about being able to maintain focus and clarity of thinking in a hostile environment. Because if the individual is stressed and if the heart rate is too high and if breathing is labored, we're more liable to make mistakes. And as he said, and he said it to me, he said, listen, he says, you could be stressed in the corporate world. That's one thing. But if my individuals are stressed, people can die. And that's a different thing. And stress and focus and concentration, the ability to hold your attention exclusively on a subject matter, on the game at hand, to be moving simultaneously with time. That concentration of the mind is also impacted by breathing, and it's impacted by sleep. So I think we need to look at all three.
And like the other thing is like immune function as well. And when we consider that, you know, upper respiratory tract infections are highest reported, even though, all right, the reported infections among athletes, definitely like just my observations among our lads anyway, you know. So again, I'm sure that, and we know that, look, if you're dealing with infections and viruses and sickness and lack of wellness, then you're not training and you're missing time on the field and you're immune compromised and you're not going to get the same physiological adaptations and so forth. So we also have that aspect of it as well, don't we?
Yeah. We've 20 clinical trials with asthma. Yeah, I know people will say, well, we should have 500 clinical trials. Well, it's a little bit of a problem funding it. And I was an author in 2 clinical trials looking at these techniques for children. And I was co-author. We had them looking at 35 children, mouth-breathing kids with asthma. These children, their sleep improved. They were missing less days off school. Now, all I'm saying is that we can translate that information, whether it's for children with asthma or adults with asthma. And asthma, okay, is inflammation of the lungs. But we also have to bear in mind that the airway is unified. If there's inflammation of the lungs, it can travel up to the nose and vice versa. You can decongest your nose in 5 minutes by holding your breath. This was written about since 1923. And what's more, the more we use our nose, the better it works for us. So I would say to any of your guys, if you have a stuffy nose, that's not just a stuffy nose. Ask yourself the question, is it impacting your sleep? Are you feeling a disproportionate feeling of breathlessness during exercise? Are you more prone to head colds? And, you know, like a stuffy nose, it is causing fatigue. It is contributing to it. So if you have a stuffy nose, breathe in through your nose, breathe out through your nose, hold your nose, and hold your breath while walking until you feel a medium to strong air hunger. Then let go, breathe in through your nose. Do that 5 or 6 times with a minute's rest in between each. Does your nose feel free? If it does, you know it's reversible obstruction of the nose. Get your Bolt score up above 25 seconds. Then your nose will work so much better for you. Now, if it doesn't feel free, then it's likely then you might have an anatomical issue with the nose. And I would do some research on that. I can't help if it's a mechanical obstruction of the nose, but I can help if it's rhinitis, you know, inflammation of the nose, you know, and you can simply test it out. Now, the other thing is I would say that sometimes people during training, if they have anatomically compromised nasal airway like mine, I've got a deviated septum. And a deviated septum is the line that divides the left side of the nose to the right, if it's off center, if it's crooked. And it's very common. And you're going to have lads that are after getting knocks and their nose is a bit all over the place. During training, you might need to wear a nasal dilator in order to maintain nose breathing. So for some individuals, your ability to breathe through your nose is going to depend on 2 things. Well, 3 things. One is the size of your nose, the size of your nostrils, the size of your nasal cavity. Number 2, whether your nose is working the way it should do, or is it obstructed? Is it obstructed reversibly or irreversibly? Number 3, your Bolt score. So I would say is get your Bolt score up, get it above 25 seconds a minimum. The goal is 40 seconds. And anatomically, check out, is your nose functioning the way it should do? And when you switch to nasal breathing during exercise, go easy enough at the start. Don't be forcing the air in and out, because it can cause a little bit of pain in the nose. You have to allow your nose to just gently become conditioned to handling that air. But yeah, in time, all it takes is a few weeks for you to be able to go to nasal breathing. Look at Dallam's paper, Dallam.
Okay, and for all those people that they're going to run out to buy tape to go taping up their mouth now before they go to sleep, what advice would you have for them in terms of, it's obviously going to be very uncomfortable for, especially if you're a deep mouth breather anyway, it's going to be massively uncomfortable whether you subconsciously or consciously are aware of that. But what advice would you have for them?
I'd say is start breathing through your nose during the day. Become comfortable breathing through your nose as much as possible during the day. Go for a light jog with your mouth closed. Just make that adaptation to nasal breathing. If you have nasal structural issues, you might need to get breathe right strips. And breathe right strips are strips that go across the bridge of the nose.
Or the Robbie Fowler ones back in the day.
Yeah, but it's pointless him wearing them, because he was wearing strips in his nose and breathing through his mouth. So I don't know what was going on there. But certainly for sleep, I had to wear the breathe right strips across my nose when I started off. Now there's two options of tape. One tape that you can get is 3M micropore tape that you'll pick up in any chemist, 1-inch paper tape. And you take the tape, and I'm just going to demonstrate it. You take, say, about 10 centimeters or so, fold a tab over either side, get your lips together, close them out. Another option for people who would be anxious, and this is our own tape, so I do have a vested interest in it, but I'm going to show it anyway. So it's Myo tape.
Okay.
And we actually brought this out for kids, to be honest with you, because we couldn't tape children for obvious reasons. So children over 5 years of age, but at the same time, I needed to get them breathing through the nose, both during wakefulness and sleep. So I developed this tape. It's just based on kinesio tape, but we changed the glue, the composition of the glue, to make it more friendly for the face. Get the tape. I've stretched it 20 to 30%. There's elastic tension now that's bringing the lips together. So there's no risk.
Okay.
So we're able to get the mouth closed without risk. That costs $25 for 3 months. So it's about €5 a month or €6 a month. So it's not very expensive. 6 months, €6 a month for a good night's sleep is a good price, you know?
Absolutely. Absolutely. Yeah. There's some great tips in that. And I suppose just to like, how would you differentiate your breathing method from the Wim Hof method, or even from like holotropic breathing methods, or, you know, because there is obviously an awful lot of breathing methods out there. And
like Wim Hof method is a very interesting method. It's a stressor. The individual hyperventilates for 30 breaths, then they exhale, they hold their breath, and because they've hyperventilated, they've got rid of so much carbon dioxide, and carbon dioxide is the stimulus to breathe. So if you breathe hard and then you stop breathing, you will hold your breath for a long time.
Mm-hmm.
And you're holding your breath for a long time because you don't feel the sensation to breathe, because you got rid of carbon dioxide. And this in turn will cause your SpO2, your blood oxygen saturation, to drop to quite low levels because you're holding your breath for a long time. Then you breathe in, you hold your breath for 10 seconds, and then you repeat it again, 30 strong breaths. So it is a stressor to the human body. And that can force the body to make adaptations. It's more so when I look at Cox's paper and I looked at the blood gases, it's hypoxic hypocapnic response. Now, where does oxygen advantage come in? We want to look at functional breathing. I want to look at an individual's breathing, not just when they're with me. I want to change their everyday breathing patterns. So I want to improve their functional breathing. I want to improve their breathing during sleep, their breathing during physical exercise, and I want to get this information across to the individual. What can you do to influence your blood oxygen saturation, increase oxygen delivery, etc., etc. So there's two pillars to what we do. We have to improve functional breathing, get your everyday breathing right. And then we do strong breath holding as a stressor,
Okay.
but we don't hyperventilate beforehand. And the reason being is just that, I suppose I spent 20 years trying to address breathing pattern disorders. And one of those breathing pattern disorders I would be addressing is chronic hyperventilation. So I suppose I'm biased to sticking with normal breathing, and also how, like, we drop the blood oxygen saturation down to about 85%. There's no risk of passing out. We can still stress the body to get those adaptations. Now, if you're doing the Wim Hof technique in the first cycle, you will drop down to 85%. On the second cycle, you might go down to 70%. On the third cycle, it could be 60, 50 to 50%. It's a lot stronger. The breath holding with the Wim Hof technique is a lot stronger, but it doesn't involve an increase to carbon dioxide. Mm-hmm. Ours is a severe hypoxia, so we do drop the blood oxygen saturation, but we also increase CO2. And this also is disturbing the blood acid-base balance. So there's similarities and there's differences, you know. So I think it's important, if you're doing the Wim Hof technique, also look at your functional breathing. Mm-hmm. Don't just rely on hyperventilation and breath holding. How are you breathing outside of it? You know, because that's really what's going to matter. Measure your Bolt score. Get your Bolt score up above 25 seconds. Now, holotropic breathing is an interesting one. I'm not sure if anybody really knows what's going on there, but it's almost that holotropic breathing that you're putting the body into a fight or flight by hyperventilation for a long period of time. And this is causing almost that the brain, sometimes you could describe it that the brain thinks that the body is dying because of the change to breathing patterns. And as a result, the brain adopts or surrenders to it. And the only reason that I'm talking about that is because there is a new book that's due out in May. And I have a galley copy of it. It's called Breath. And this is by Penguin Books. It's by a guy called James Nestor. And he's a journalist from the United States. So he has looked at nose breathing, and he's looked at a lot of stuff that I've done. And he's looked also at holotropic breathing and the Wim Hof technique. And in their explanation of the holotropic breathing, it could be, or at least one of the explanations is that we are stressing the body almost to the point that the body is surrendering trauma. So doing short-term hyperventilation, yeah, okay, it's not really short-term, it's half an hour or an hour, but it can be very beneficial. I've spoken to people, it's very, very beneficial. Yeah, so I suppose different breathing techniques can impart different benefits.
Yeah, absolutely. And come here, Patrick, I'm really grateful for your time.
Sure.
There's a tremendous amount of information and highly applied information to everyone. And I suppose the last thing I will ask you is, because of the fact that, look, you know, we're in the middle of a pandemic, and I didn't realize that there was so many people with breathing and we'll just say respiratory issues that obviously are highlighted now because of the state of play in society. Like, what advice would you give to anyone? Now, I know you did make a little webinar there and stuff like that, but just even if it was they had 5-6 minutes a day that they could try to integrate into their everyday lives. Now, I presume that the baseline test would be the breath holds, and we want to keep an eye on those breath holds. And I'd imagine if they're consistently reducing, there would be a correlation with like a lung function or a lack of lung function, I'd imagine. But
yes. If there is dyspnea, which is one of the symptoms of COVID-19, breath hold time is naturally going to reduce. So if you were to measure your Bolt score every morning, or the control pause every morning, so as soon as you wake up, sit up in the bed, allow your breathing to settle, breathe out through your nose, a normal breath out, pinch your nose and time how long are you holding your breath for. And if you're seeing that it's dropping. Now, I heard a Japanese doctor, they use breath hold time in Japan as an indicator for patients, just to give to the general population as a marker of, maybe as an indicator of, you know, if they were feeling breathless. I know it could be normal that you would feel breathless, but as a measurement of that, a more objective measurement, breath hold time would be helpful. I would say as well, like, I've been traveling so extensively. I was in tubes, jam-packed in London, up to about 10 days ago. And I remember literally we were just on top of each other. I did two things there. One is I breathed hardly any air as possible. And the other is I breathed it through my nose. Because even when I look at James Nestor's book, he looked at doctors back in 1920s. He writes in that book that the individuals who were more prone to tuberculosis were mouth breathers. Now, is it true that nasal breathing is going to help defend against COVID? I don't know that. But I'm going to put this out there. Your nose is a source of nitric oxide, and nitric oxide has antiviral properties. If you look at the work of Professor John Lundberg from the Karolinska Institute in Sweden, and also if you look at papers looking at humming, which can increase nitric oxide 20-fold. Now, also if you Google nitric oxide, COVID, clinical trials, you will see that there's a number of clinical trials now taking place currently in the United States, that manufacturers, pharmaceutical interventions are coming out with nitric oxide, inhaled nitric oxide, as a means to target COVID. So nitric oxide is a sterilization of incoming air. And also, COVID seems to be attacking what's called pneumocyte or type 2 pneumocytes. And this in turn then is reducing the production of surfactant. And surfactant is like, I suppose, a washing up liquid or a detergent. And it plays a role, of course it's not, but I'm just giving you an analogy. It plays a role in the elastic tension of the alveoli so that the small air sacs are able to expand and contract freely. But nitric oxide also plays a role in the production of surfactant. So I would say to you is the breath hold that we were doing can help increase the accumulation of nitric oxide in the nose. Humming. So you'd hum out through your nose, but make sure that you breathe in afterwards. Nasal breathe with slow breathing, both during wakefulness, physical exercise, and sleep. Like, can you imagine going to a gym? Everybody is there as mouth breathing. You have an individual who is infected that mightn't be infected. They are mouth breathing. There's a 42% greater water loss breathing out through the mouth. That's 42% greater amounts of airborne water particles that sprayed almost like an aerosol. And you have another individual in close proximity. He or she is breathing hard because they're doing physical exercise with the mouth open. You've no defense.
No.
You know, so I know doctors have said to me, well, we don't know about the concentrations of nitric oxide. Is it high enough in the nose to defend against COVID? Listen, we don't know that. Nobody knows. But all I'm saying is one thing. Whatever chance we have of defending against any viruses that are airborne, we have none if we breathe through the mouth. And there's no risk. Just continue nose breathing. And if I'm in a shop now, of course, we're not moving at all now, but when the restrictions lift in 3 weeks, say 2 weeks, if you go into a shop and there's somebody in a queue there, okay, we're supposed to maintain a 2 meter distance. How do you get it past that person? All I was doing was breathe in, breathe out, hold my breath, and I would walk past the individual. So make sure that if you are in close proximity of people, don't breathe or walk away.
And it should make some, because I actually done that going back about 7 or 8 days ago, and it made, I don't know why I done it, but it made some kind of intuitive sense to me just to breathe through my nose and restrict I was in the queue in a shop actually, and it was a group of younger people came in behind me and they were literally coughing on my back, and for some reason, it just made sense to do that. And even when we bring it back to the gym environment, it's going to be essentially an absolute perfect storm for transmission of infections because cortisol levels are up, heart rate is up, then you have your issue of mouth breathing, sweat. So that is a really, really good piece of information. And again, all these things are free and they're there. That's the beauty of having these conversations, that hopefully some of this will resonate with people. And we were saying it takes 20 years for things to pass through in medicine. Unfortunately, if we could get anything from this current crisis, hopefully we might get this message out, and we might try and get push it forward a small bit.
I would be delighted. It's been my mission. I spent 20 years with an open mouth, medication, asthma medication after asthma medication, sleep impacted, concentration, mood. And no, it's been tremendous for me, and it's been tremendous. Like, I've worked with many thousand individuals. I put out 8 books, and we've feedback coming in from people. And as I said, like Adrian, it costs nothing to breathe through your nose, to gently slow down your breathing, and there are benefits there. And that's why I'd say to people, give it a go. You know, you've nothing to lose, and you've got a lot to gain from it.
Yeah, Patrick, come here. I want to thank you for your time, being so generous with your information. Okay, and I wish you all the best, and we might touch base again and do this again.
Great, lovely. Thanks very much,
Thanks,
Adrian.
Patrick. Cheers.
Take
Thank
care.
you.
Bye.